I just remember a pop, and it wasn't anything that was like, oh gosh, that was so horrible, or it was just like, that didn't feel normal, but I was so used to being popped and everything, I just thought it was just part of life, you know? And then it just got worse and worse and progressed, and that's when I started going to doctors, because I was like, there's something wrong here. Like that's like when all the swelling started, and just like the pain and the tingling and everything. I was doing mixed grip pull-ups.
Okay.
And I don't know if it was because I was in an L-sit, or I don't know, maybe just the weight distribution was different or something, but I came down and it just popped, and it was loud, like I could hear it. And it's just like, that wasn't normal. But yeah, and then I got an x-ray, and they thought I had chipped my collarbone, and then they wanted an MRI to make sure that it was that, and then they thought I had a blood clot, and then all of these things progressed, and then I thought it might have had something to do with my asthma, because at that same point my asthma was accelerating at a really rapid rate. And so I redshirted my outdoor season that year to try to figure out what was going on, but it didn't really work. Nothing. I couldn't figure anything out. Yeah, they really thought I had a blood clot for a while, to the point where it was like, you need to go get an ultrasound like immediately, because they thought it was up in that area. But I went, and they were like, there's nothing here, I don't know what's going on. So, and then I took the summer off of training and everything like that, and I think that summer I didn't work for my dad, which has a lot of heavy lifting, so I don't think that, I think it healed kind of in that time frame. And then went back to school, had a pretty decent year training that year. I was a junior, and I just, in the weight room, I cautioned myself. Like, I was like, well, I can't do that, so I'm not gonna do it. Or I would do like way less reps or weight, or just so that I could get by. And then that summer, worked a lot, trained a lot, and then in the fall, it was just to the point where I couldn't, it would hurt in workouts. I had shooting pain down my whole torso, down my arm. There was pressure, and the swelling wouldn't go away. Like, and that's when I was seeing a chiropractor, because everything was kind of like slipping. And he was like, you need to go to a doctor. Like, you need to figure this out. I don't care like what your training staff says, because my training staff was like, there's nothing wrong, we already tried. And he was like, I don't care, like, there's something wrong. And so that was kind of reassuring that at least I wasn't crazy. And so I got all of these tests done. I got injected with, I got cortisone in this shoulder because they thought maybe that would help. I got this numbing agent in my joint to see if that would help. I got some electrical tests to see about my nerves in my arm, if anything was damaged. I probably went to a specialist every 2 weeks that year, and it was just very disappointing and frustrating, because I couldn't train. It was like not effective, because I would maybe warm up and pole vault like maybe 3 or 4 times, and then the pain was just not something that I wanted to continue with. So I ended up redshirting that indoor season, and then continued going to these doctors and not finding anything. And so I was at the point in March where I was like, well, do I burn my outdoor season, or do I suck it up and compete outside? Because I was gonna lose it either way, even if I competed badly. I was like, well, so I competed outside that year, and when the season was over in May, my arm just went to crap. I couldn't do anything with it, like to the point where I couldn't even like pour my own glass of milk. Like, my arm couldn't have that function. And so it was, my body made it through my last meet somehow, and then it's like literally the day after, because we were in Hawaii, and the day after my mom and I went surfing, and like I was just on the board dead, like my arm was dead. So it knew I was done. November of 2008. Yeah, and I started going to the doctor in January of 2009 because I was like, well, we'll just see. Well, my mom, they told me, because I went to school in Boise, and they told me that pretty much like you're on your own to find someone because I can't help you. Like nobody can help you here, and you think there's something wrong. We don't think there's anything wrong, but you think there's something wrong. So find someone on your own. So my mom called Children's and was like, I know my kid is too old, but can you refer me to someone, because we've come here in the past and you've really been effective with blah, blah, blah. So they gave us Dr. Warme's information, and my mom called and was like, I don't know if I need a referral or how we get involved in this process, but I think this is where we need to be. And I would say that appointment was early June of last year, so 2011. And I came here and I was pretty terrified because I didn't know if this wasn't gonna work. I didn't know what to do next, because it was to the point where like I couldn't carry a bag of groceries, like I was driving only with my left arm, like, and so I was just like, Mom, what do I do if this doesn't work? And she's like, well, we'll figure that out once this doesn't work. And so came here, I was in here for maybe 10 minutes, told them my story, got a CT scan, was like, oh, well, this is what we're gonna do. And I was like, okay, didn't really have to think twice about it, because at that point I wanted to keep training. We knew that might not be a possibility, but besides training, I wanted to be able to live a normal life without having this. Well, when I came here, my mom was really worried in the sense that like when I was standing straight, my right shoulder dipped quite a bit lower than my left. It was evident just looking at me, and I was having problems. All my rib heads were popping out, and I was getting put back into place in like February, March, 2 to 3 times a week. And it hurt, because it hurt when they'd come out and it hurt when they'd go back in. I couldn't train at all. I was waking up in the middle of the night like from discomfort, and that usually doesn't happen with me. So that was starting to be like, this is a big problem. I couldn't really drive with this arm. It would just get so tired and limp. And as weird as it sounds, I could tell I didn't train at the same level I would have liked to then, but even when I did, I could feel like my breathing was different, especially now. Like my breathing was much different last year than it is now, and it was just different. It didn't feel right, and an inhaler wasn't helping it because it just didn't work. If you're okay living in pain every day, then okay, but if you're not, there is an answer. I mean, I had my general practitioner tell me that Western medicine cannot fix what I had wrong with me if there was something wrong with me. And I sat there and was just like, what? Like, at some point I would like to be able to hold the kid that I have in however many years in my right arm. Right now I know I can't do that. And she was like, well, I just don't understand why you're going up there to UW. They're not gonna find anything wrong. Like, I was like, how can you say that? Like, I'm gonna keep looking. I mean, I've been looking for 3 years, 4 years. I'm not gonna stop looking now. And I couldn't be happier with what I found. And even though it took a while, I'm glad that I kept going, because who knows where I would be now if I didn't come here.